Thank you for joining us. I'd like to acknowledge and thank members of the Board of Managers and the Board of Legislators, Ms. Jenny Jones from the Board of Managers, and legislators, Phil Hathaway, Ian Gilbert, Vice Chair Jerry King, Chairman Larry Dahlhoff, Andrea Morahan, Dick Chartrand, and Tom O'Brien. And from the Board of Managers, its chair, Mr. Mike Young, and also County Manager Ryan Pichet. Joining me today in this briefing is Dr. Sean Harney. Sean is our CMO and longtime member of the community, experienced physician, served many years as in the emergency department and also supporting the jail facility. I'll work through some prepared remarks, and then after that, Dr. Harney and I will take your questions. I'd like to highlight on the table 2 masks and information supporting or identifying 3 different vaccines that are available to us. Moderna, Pfizer, and J&J. Vaccines and masks are 2 actions we individually can take to contain the transmission of the COVID-19 virus. Wear a mask and get vaccinated. COVID-19 positivity rates for Lewis County and the North Country are trending in the wrong direction. Lewis County's 7-day average is 7.6%, and the 14-day average is 5.7%. Because our county has hit the 5% threshold, visitation is now restricted at the health system as the rolling average is over 5%. The North Country 7-day average is 6.1% and the 14-day average is 5.5%. I will repeat, the COVID-19 positivity trend line over the last 2 weeks is moving in the wrong direction and putting our community at risk. Lewis County has the highest 7-day and 14-day positivity rate in the state of New York over the last 3 days. 2 weeks ago, the Public Health and Health Planning Council approved a revised emergency regulation requiring the COVID-19 vaccine for healthcare personnel. The new regulation removed the religious exemption option. Under the regulation, covered healthcare personnel is defined as all persons employed or affiliated with the covered entity, whether paid or unpaid, including but not limited to employees, members of the medical and nursing staff, contract staff, students, volunteers who engage in activities such that if they were infected with COVID-19, they could potentially expose over covered personnel, patients, or residents to the disease. The deadline for personnel in general hospitals and nursing homes to receive their first vaccine dose is September 27th. The regulation does allow for a medical exemption certified by a licensed physician or certified nurse practitioner, but must be in accordance with generally accepted medical standards. When I was invited to be the CEO of the only health system in Lewis County, I became the steward of one of the county's most valuable resources. As CEO, I have a fiduciary responsibility to the Board of Managers and the Board of Legislators. Also, access to health care is an essential service on par with education, transportation, public health, and law enforcement. The health system is a vital piece of the county's economic well-being. We are the largest employer in Lewis County. The economic activity generated by the health system through jobs and purchasing of goods and services is $115 million. And that activity has generated 900 jobs. I have been asked several times if I support the vaccination mandate for healthcare workers and others. The answer is unequivocally yes. The COVID-19 vaccines are effective, and when combined with masking, healthcare workers, patients, residents, visitors, in the larger community are provided the highest level of protection. Essential health services are at risk not because of the mandate. The mandate ensures we will have a healthy workforce and that we are not responsible for transmission in or out of our facilities. Today, this is how COVID-19 transmission is impacting the health system. Lewis County Health System has 5 employees in quarantine, 5 employees in isolation, and there are 4 community members hospitalized at LCGH who are COVID positive, and they are ill enough to be inpatients. I do recognize that in the short term, if members of our team, Sean and mine, are not vaccinated, services are at risk. We as employees have an obligation not to put those we care for or our co-workers at risk. So you might ask, what is our current state? Since the mandate was announced, I'm pleased to share 30 additional employees have been vaccinated. Unfortunately, we've also had 30 employees who have resigned. 21 of those employees who have resigned are in clinical areas, so 70% of the resignations received to date. Our vaccination rate is now 73%. 464 individuals in the health system are now vaccinated. Thumbs up to the team. There was a period we were second or third worst across the state of New York. We are now better than average. So great progress in the last 3 weeks. 165 employees are not yet vaccinated, and it is not clear what they will do. We have received and approved 3 medical exemptions. 12 additional employees have indicated they will seek a medical exemption. We are waiting to receive them. We have initiated discussions with the Department of Health regarding the maternity unit. We are unable to safely staff the service after September 24th. The number of resignations received leaves us no choice but to pause delivering babies at Lewis County General Hospital. It is my hope the Department of Health will work with us in support of pausing the service rather than closing the maternity department. There are several other clinical departments at risk based on the number of unvaccinated individuals in those departments. We are encouraging staff to get vaccinated. Dr. Harney has led many educational sessions and has met with many staff one-on-one. Many individuals have expressed concern with how fast all of this is happening. I don't disagree. 3 weeks ago, former Governor Cuomo and Commissioner Zucker announced the COVID-19 vaccination mandate for healthcare workers. We have 2 weeks remaining for 165 staff to receive the first dose of the vaccine. And at the same time, we must develop contingency plans for services we believe are at risk. We can't wait till the last minute. We have not been given much time, and it is a hard deadline before us. The vaccine mandate is not an option. We must follow the emergency regulations. We are obligated to. To our elected officials, Haney's and Iroquois, I have passionately communicated my concerns, including the potential and likely impacts to our facility and the community at large. And I have suggested alternatives to the current regulation. I believe I have been heard and information is being shared with the DOH and the Governor's office. So that concludes my prepared remarks. Dr. Harney and I will take your questions, and depending on the question, we will just hand off to each other. So thank you.
Jerry, just to be clear, did you say that effective September 24th was when the hospital would stop delivering babies?
That will be our last day delivering babies, and then starting on the 25th, we will go on pause. However, it's a little deeper than that, so why don't I hand it off to Dr. Harney and he can provide some additional potential details.
So with the resignations we received yesterday from employees from the maternity department, it became obvious that we did not have adequate staffing starting on the 25th of September. So we began the process of trying to develop contingency plans to make sure that our patients can receive the safe care that they need. So that all is in process. It was just in the last 24 hours that it became obvious that the schedule was not adequately filled starting the weekend of the 25th. So we have initiated discussion with the Department of Health, with the Regional Perinatal Council, with the managers and leadership at the hospital to try to develop a plan. I've met twice this week with, actually 3 times this week with obstetric providers at our facility to try to do the best we can to provide for the needs of our patients in the community.
Okay. And is that just the delivery portion of maternity, or will people still see their providers at Lewis?
So our outpatient women health office is not going to change. That is still going to be a full service women's health service. The problem is we'll have to, depending on what sort of contingencies we can develop, patients may have to be referred to another facility, like in the 3rd trimester or at some point when they need the final portion of their prenatal care to arrange for their maternity care and postpartum care. But the office will not change, and we'll try to offer as much of the women's health services that we can right at the health system. It's just the maternity department and newborn nursery are the areas that are not going to be fully staffed on the 25th of September.
And Jerry, you mentioned that there were potential other areas at the hospital that, based on the vaccination rate, that services may be impacted. Are you at liberty to share which other services may see impacts from this?
Yes, so we have areas that we have an unusually large number of unvaccinated staff, and I'm not comfortable at this point, because we are actively working with the team, encouraging vaccination, and also working through how we might redeploy other staff appropriately credentialed to work in those areas. So an example of that, I have asked our chief nursing officer to put together a list for me of every nurse who has more of an administrative responsibility. So an example might be a nurse who works in staff development or a nurse who works in information services, who we could redeploy to the clinical areas. So that's very active. The difference between that circumstances and what Dr. Harney has described, there's this unique time to transfer care when a woman is in the 3rd trimester and approaching delivery. The other services don't require that same length of time, so we have more time to develop the plan.
Sorry, Jerry, could you give us an idea of what percentage of your maternity staff resigned, making it so urgent, particularly in that department?
Yeah.
One of the caveats to that number is that we were already up to this point short-staffed in maternity. And for example, the manager of that department, the nurse manager, has been taking shifts for weeks now, working as a staff nurse, just to fill the schedule as it is now. From what I understand from the regional perinatal center call this morning, many other facilities are in a similar circumstance, all the way up to large facilities like St. Luke's and Krause. So there's a shortage of experienced maternity, labor and delivery, and newborn nursing staff in the region.
So,
And that's pre-mandate.
Just a follow-up with that, is that regional specifically, or is that a national, in that particular area, that's a national issue?
I don't have an answer to that. I don't
Okay.
know what it is in other states. I know throughout the upstate region, pretty much across north of the city, I know that there's pretty much a shortage throughout upstate New York.
you know, the vaccination mandate has taken our eyes off the real challenge here, and that is there is a critical health care staffing challenge. And we have been recruiting for nurses for years and for OBGYNs for years. We are not alone. There are thousands of positions that are open north of the thruway. And now we have a challenge to work through with, the vaccination mandate. So that's why the word pause is so important to us. If we can pause the service and now focus on recruiting nurses who are vaccinated, we will be able to re-engage in delivering babies here in Lewis County. So we've had 6 resignations in our OB service, and we have 7 individuals who are undecided. So, the math is just not working. And I want to be clear, we have really tried and worked hard to be transparent, with the people I engage with behind me and with our staff. And from day one, when we were notified about the mandate, we truly have worked hard to educate, encourage, cajole, support individuals to get comfortable receiving the vaccine. But Sean and I have talked about this. We aren't passing judgment on any single person who says it's not right for them. And we really are respecting that. It's not, we don't want to lose anyone. We would like everyone to be vaccinated. But we also understand we live in a place, in a country, where you get to choose certain things. And if you choose not to be vaccinated, then now you can't work in healthcare. We just simply respect, we thank for service, and then we each move forward.
And as far as the vaccine mandate goes, I know you keep referring to the state's mandate. With the announcement yesterday from President Biden with the federal government's mandate with facilities that receive Medicaid, Medicare funding, things like that, which would be your facility, is there any differences in the mandates? Is one more significant than the other, or?
No, it's, I'm not aware of any meaningful changes.
I haven't studied that, the regulation yet.
For one of the things I hear a lot from our team is there are certain sectors of the economy where there's a test-out option. Test-out option is not an option for healthcare. And I appreciate where individuals are frustrated by that. I understand why we don't have a test-out option, but just by understanding it, you can, I guess, logically accept it, but emotionally that's a tough one for folks.
I think the other tough one for a lot of people that I've spoken to at our institution is this is one of the few mandates that does not allow consideration of a religious exemption. That was taken out in the latest iteration of the mandate. Initially, when it came out on August 18th, it allowed for 2 exemption options, medical exemptions and religious exemptions. A week later, the final format of that, approximately a week later, the final format of the mandate came out, and it rescinded the possibility of considering a religious mandate or a religious exemption. And that is, I have, in my counseling, talking to people, trying to answer their questions about the vaccine and COVID disease, how the Delta variant has influenced the circumstances. One of the recurring themes that I have gotten asked from employees is, why can I, if I object on religious grounds, can I not have that considered?
Okay.
So
And
that,
on that point,
Oh, go ahead.
I have, working through Haney's and Iroquois, we have brought that concern forward. They have brought that concern to, the DOH. And, at this point, it is, even with all of that advocacy, it is a position that the department is not backing away from. As part of that, we also evaluated Title VII, which is, the federal law, and it does not allow us to violate, in this case, the state guidance regarding the religious exemption. Now, while we're working through that process, a number of staff, as Dr. Harney shared, brought up that concern. So we had them complete the religious exemption form in case we could potentially have some meaningful influence there, and we were not able to gain traction on that one. So religious exemptions will not be recognized as part of this process.
Follow on that though, for either one of you. Aren't some vaccines already mandated to work in healthcare? For example, you need your MMR, measles, mumps, rubella. You need to be titer tested if you haven't got records proving it. Sometimes, now there's new rules where you might have to be titer tested every 10 years. In some circumstances, if there was a religious issue, are people exempted from those things?
No, there are no exceptions unless they're contraindicated or there's a medical exemption of some sort. Is there anything more you would add?
No, so everybody working there already has vaccines that didn't violate their religions, ostensibly?
Now, one that jumps out to me is the flu vaccine. So an individual can opt out of the flu vaccine, but then they have to wear a face mask through the entire winter. And we have a number of folks who do that. But I'm not aware of any special exemption that was requested. They had a choice to get the flu vaccine or decline, and if they decline, they wear the mask.
But people can't decline from certain mandatory vaccines is my point. They can't.
Correct.
They can't say, I want to work in healthcare, but I don't want my measles, mumps, and rubella booster or vaccine, whatever the case is. Anyway, there's no religious exemption for those?
Not that I'm aware of.
COVID's not the first vaccine that healthcare workers are mandated to have.
correct.
Would that be accurate?
That would be fair.
Are there others besides MMR?
Hepatitis B.
Brian, excuse me.
What's the logic behind, because again, this is just from the side of the fence, because I have a lot of friends who are in healthcare, and they have told me time and time again, they would stay for whatever reason why they don't want the shot, but they would stay if they could wear the mask and test every week. And you said that testing has no place in terms of being a worker in healthcare for this disease. Why is that compared to the flu?
I think it's as simple as it's highly contagious, and if you are unvaccinated and catch COVID, especially the Delta variant, you will be hospitalized and there's a higher risk of death. I think our elected leaders are working very hard, and appointed leaders working very hard to corral the COVID-19 virus. And they're trying to limit how many exemptions or options for opting out of the vaccine. And when it comes to healthcare, because the people we work with every day are truly on the front lines. You know, we have staff interacting with COVID positive patients today on med-surg. They're really being quite strong on that point.
As far as the mandated vaccine goes, obviously we have the Pfizer vaccine, which is fully authorized. You have the Moderna vaccine, which is under emergency use, close to full authorization, and you have the Johnson & Johnson under emergency use. Does it matter which of the three vaccines? And my follow-up to that question is, a lot of the people that I've kind of had conversations with vaccine hesitancy, kind of refer to the fact that the mRNA vaccines haven't been out very long, things like that. Are all three of the vaccines mRNA, and is there one that isn't?
Well,
For
Sean,
people
I think
with that concern.
That's an invitation for your counseling session right there.
So yeah, two of the vaccines are mRNA technology, Pfizer and Moderna. Pfizer is the only vaccine that has been fully authorized. You're correct, Moderna is currently still being administered under an emergency use authorization. However, their paperwork has been submitted to the FDA for consideration of full authorization there too. And then the third vaccine, all of which qualify the vaccine mandate by the state. The third is J&J, and that is not an mRNA-based vaccine that uses an adenovirus vector.
And that's more your traditional type of vaccines used?
It's been in use long. That mode of vaccination has been in use significantly longer than mRNA. There's been several that have been used that way with that vector. Yes?
My understanding, looking at this ever since COVID came around and the vaccines were in research and development, it's my understanding though, although the mRNA vaccine itself for this is completely brand new and it's only been out now for however many months, has there been research on mRNA prior to this?
Yeah, there's been a lot of research on using mRNA as a vaccination technology for decades. It was back in the 90s that they started work on the concept of using mRNA sequencing, and they've been working on it since then. My understanding of how we got this vaccine so quickly, which is another thing that many people hesitate on, is one of the viral targets that the researchers were using was the original SARS virus. So they developed an mRNA vaccine to SARS, which could never be effectively proven to be effective because SARS never developed into a widespread infection. So they didn't have a population they could do effectiveness studies on. So when the genetic sequence for SARS-CoV-2 or COVID-19 became available in late January of 2020, that genetic sequence was put into what was already developed as a vaccine for the original SARS, and that's how they were able to get a vaccine so quickly, because they had already developed the all of the other components of the vaccine technology, how to produce it, the lipid nanoparticles. That was all developed ahead of time. So they took the new mRNA sequence, put it in the old SARS vaccine. They started actually administering it in March of 2020, only less than 2 months after they got the genetic sequence. The way they did that was they had done all the research behind this ahead of time. So that's a good observation on your part.
When you talk about the numbers of unvaccinated in the hospital, I mean, if you kind of split, if we talk theoretically here, I mean, since the mandate happened, you said 30 have resigned and 30 have gotten the vaccine. You take that 165 and you split it in half. Say if 80 more employees from the hospital resign, 80 get the vaccine. If 100 resign total, talk about numbers here, within 3 or 4 week span, what will that do for your system?
It depends on which areas they would be resigning from, which is why we are developing contingency plans right now in 5 other areas. So it really is dependent at this point which areas, and then depending on those areas, we'll determine how we are able to reassign nurses who have been in the last period of time in administrative functions back to their clinical functions, because we need some ramp up time around, re-educating and demonstration of competencies.
And how have you continued to kind of talk with employees and staff about the vaccine, and kind of how has the effort been going over the last couple of weeks?
Yeah, so, we communicate the way most of us communicate now. We use email system, in our internal email and our internal mocks, and meet with our management team face to face, and then they are out at their individual work areas. And then a subset of us, Dr. Harney, myself, and a few others, hold smaller group meetings, usually unit-based or department-based. So that's how we do it. But there's an old adage when it comes to communicating, 9 times, 9 different ways, right? And so it's one of those things, there could always be more, and we're cognizant of that and trying to do that. I do like the email format because it is a way to communicate with individuals who you're not able to meet with, and it's a consistent message that you get out to the organization. If you have 6 different staff meetings, little nuances might occur when you're speaking, and then that could lead to some confusion. So 9 times, 9 different ways, and make every effort to be available for every department is how we're trying to do it.
And back to the maternity pause, when you reference it as a pause, what would it take to unpause maternity? Like, would it be like a recruiting process, kind of like starting over, or convincing maybe some, like, people that have resigned, if they change their mind and end up deciding they want to get vaccinated,
Absolutely.
might be welcomed back?
We've been very clear on that point, Nick, and thank you for bringing it up. Anyone who has resigned, who changes their mind, will be welcomed back. So our hope is, as we get closer, the numbers will increase of individuals who are vaccinated, fewer individuals will leave, and maybe with a little luck, some of those who have resigned will reconsider.
But as of today, September 10th, the only service currently that will be impacted by this is going to be the maternity, with a potential for other services.
That would be fair.
Okay.
The only one that it is clear at this point
Correct.
that will be significantly adversely affected, depending on a handful of key individuals in certain clinical areas. Some of those other 4 areas could definitely be impacted.
What's the reaction been to those of your staff who are vaccinated? How are they reacting to the dichotomy, to their colleagues, taking their freedom, their perceived freedom in this? Or is it more of a, hey, we're being responsible, why aren't you?
I think it's all of that. Our workforce represents a community. We preach, we care for our families, our neighbors, our friends, and our coworkers. If you really look at the roster who receives care in our health system, they fall generally in one of those 4 buckets. So we do try to we do use this language, we are a family, and that's a loaded statement, and like all families, there are times where people disagree, and at times, think about Thanksgiving dinner. What don't you talk about at Thanksgiving dinner, especially over the last few years, is politics, right? Well, now you don't talk about mandated COVID-19 vaccine. It generates strong response. So our team is working through that, and I think people are managing it well, but it is a tension point.
With the Dr. Harney and you now and in past cases have referenced the kind of the shortage of healthcare workers, or being able to recruit and things like that. Does the hospital have any plans, any intentions, like what kind of policies that you could enact or things that you could do to kind of make the health system stand out when attracting new employees?
You want me to jump, or do you have
Yeah,
any
you
thoughts?
can jump on that
Okay.
one.
So once we get through this current crisis, I think we need to step back and completely reevaluate our recruiting approach. Everyone in this room understands when you accept money from state government and federal government, you have to live by certain rules. You give up some autonomy. And when you work in healthcare, between Medicare and Medicaid, it's nearly 90% of our revenue. So government has a strong influence over us. We have to step back and rethink this. I hope this period doesn't last too long, because it will actually hurt our recruiting efforts. And there is a push among the population of wanting to know, is my healthcare worker vaccinated? And so on all of our badges, if we are vaccinated, we have an orange sticker that shows whoever we interact with that we have been vaccinated. People are starting to notice. People are starting to want healthcare workers who have been vaccinated. Not everyone, not every time, but it is increasing. So clearly moving forward as we recruit, whether they're physicians, nurse practitioners, nurses, administrative types, are you vaccinated? And if not, will you accept the vaccination before your first day of work? And if the answer is no, they will not be offered a position. Yes, Brian.
Are employees here at Lewis County Health System or at any other hospital or healthcare network in the state going to be eligible for unemployment if they choose to do so to resign?
Yeah, so I specifically, once again, asked that question through Haney's, and Commissioner Zucker addressed that in a conference call for the CEOs, and it is shared understanding that individuals who resign because of the mandate for COVID vaccine are not going to be eligible for unemployment, or individuals who are terminated for cause by not getting the vaccine.
Are employees required to give 2 weeks' notice? So if they haven't told you by Monday their decision, is there a penalty for that if there's
So there is a tension point there. And yes, there are accrued benefits, and those accrued benefits will not be paid out if they do not serve their notice in alignment with policy.
That's all lined up in the union contract. So
That's across the board, or a
That's
certain
across-
level employee?
Yeah, it's across the board.
So is Monday like doomsday? Not for the drama, but like that's the big day. Likely people won't want to give up their benefits.
Well, it's a day that we hope to have greater clarity on the 165.
Does the union have a position with their workers? Are they recommending they get vaccinated, or are they not taking a position?
Yeah, again, another tension point. Our bargaining unit is CSEA, and CSEA in Albany has supported Governor Cuomo when he made the announcement, and they are supportive of our current governor and her approach. Locally, some of the leaders feel differently, so we're working through that. Okay. Wow, you surprised me. I expected many more questions from you. All right, is everyone good? Okay, well, thank you for your time today. And if you have follow-up questions, you know where to reach Dr. Harney and I. All right, thank you.
Thank you.